Hello, my name is Angela Broadbent and I'm an assessment teacher. I work for the PD Outreach Service based at Regency High School. I'm going to share with you today a webinar based on our team and how we can support you in early years settings. So, supporting children with physical disabilities and/or complex health needs in early years settings. So just a little bit of housekeeping. So this webinar has been pre-recorded. If there is anything that we haven't covered or the webinar has raised further questions for your setting, please email eyinclusion@waschildrenfirst.org.uk with any questions. If you put the title of the webinar in the email subject bar, that would be really helpful, and all questions raised will be compiled and answered on a frequently asked question sheet, which will be available to download on the following webpage. So to create the webinar page on inclusion. Additional areas of learning will be included in the following term's webinar. So today's webinar, my content and aims. So I'm going to give you an overview of the teams, and we're going to talk about physical disabilities and explain them a little bit. We're going to explain complex health needs, give you top 10 tips for creating a physical disability friendly environment in your setting. We'll talk about how to complete healthcare plans and risk assessments, how you can then refer to the team, the support your parents and carers will receive from our team, the support you as an early years setting will receive, and then we'll give you contact details of the outreach support teams and the early years inclusion team. So first of all, an overview of the physical disability outreach team. So there are two teams, one in the north of the county based at Chadsgrove and one in the south based at Regency High School. Both schools are special schools, so we have contact with our colleagues in special schools as well, which gives us an additional source of contacts and expertise to call upon. So the North team is comprised of specialist teachers and a specialist teaching assistant who have many years' experience of working with pupils with physical, medical and learning needs. The South team is comprised of assessment teachers who have a background in teaching in special schools for many years. So each team has a caseload of over 200 children aged between 2 to 19. Some have very complex needs and we see these children regularly, and others we see infrequently or only at key points in their school life, like when they start nursery or move schools during transition periods. We aim to support children in early years settings and schools so they are included as much as possible alongside their peers in their local nursery or school. And down below you'll see a couple of web links. So there's the links to the teams north and south if you ever want to read online more of our content and how we work. So just a quick overview of physical disabilities. So we support children with a diagnosed physical disability and/or medical condition which affects their physical functioning and access to a mainstream nursery curriculum. So this would include a wide range of conditions such as cerebral palsy, muscular dystrophy and spina bifida. However, some children don't have a diagnosis, but their physical functioning is such that they require input and the provision of specialist equipment to access the curriculum. So this would be children who may have global developmental delay. Some children may have Down syndrome. Some children may have other undiagnosed conditions. Some children have experienced medical trauma, which has had an impact on their physical functioning. So they've had an accident, or they might have an acquired brain injury due to a sporting accident or a car accident. Some children may have learning difficulties and sensory impairments in addition to a physical disability. And in terms of complex health needs, so children with complex health needs are supported by our team alongside the health professionals within the county, such as the community nursing team, which is called the Orchard Service, the specialist epilepsy nurse, Cheryl Bird, and other specialist nursing teams, which would include areas such as continence, skin care and oncology. Children often have long-term medical conditions which impact on their ability to access the nursery environment, both the physical aspects of accessing the environment and the learning. Without some form of adult support and adaptations, these children would really struggle. We also support cooperative children. Such medical needs include children with long-term heart conditions, breathing conditions, complex continence needs, e.g. they might need catheterizing every day, complex epilepsy, as well as children going through treatment for cancer. Our support focuses around the physical access, the equipment and the implications for learning. So there could be cognitive difficulties attached to the treatment that children receive for cancer, such as memory and processing difficulties. There are a number of young children who require tube feeding in nurseries, and training is provided by the Orchard nursing team. So top 10 tips for creating a physical disability friendly environment, and this is not an inclusive list. So be inclusive from the first visit, welcome families and children and see solutions rather than difficulties. Sometimes the solutions that you might have as a setting are really inexpensive, like the provision of a grab rail, or if work needs to be done, plan for them over time and think about it as an investment in the long term for children coming next into your setting. Involve the professionals that work alongside you and gain as much information on the child and their needs as you can. Ensure all the paperwork is in place and all the support is in place prior to the child starting, and work together on this. As many relevant staff as possible in your setting need to know about the individual needs of the child with a physical disability. So good practitioners regularly evaluate their practice, and training must be started before the child starts in your setting and be ongoing as the child grows and their needs change. Parents and carers are the experts and the child is the absolute expert. So often they will have worked out the solution themselves. So consult them. So ask them, what do they think and how do they think? How do they do it at home? Often there's an easy answer. So be creative with your environment, creating routes and clearing clutter, both the physical and the visual clutter, can make spaces for the child with a disability to get about, and it can also be hugely beneficial for all the children in early years and the staff working. So not just the child with the physical disabilities, because everybody's got easier access to the environment. Look at all the areas of the curriculum in the nursery. If it's not possible to make reasonable adjustments, like there are stairs or the environment can't be adapted, what alternatives can you offer? Consider the language that you use, keep it clear and simple and reinforce with visual cues. Allow for processing times, which can be longer than you think. Simple solutions for inclusive practice often work best, like moving more mobile children to the area with the physical disabilities. The child with the physical disabilities is playing, rather than keep moving the child with a disability. Adapt resources, like make them larger, slower moving, or anchoring them on a table can help. Make sure any equipment the child needs is in place and used as recommended as soon as possible, like a simple bath step that can make a child be able to reach a tap. Make sure it's there for whenever they need to use it. So no child learns well unless they can access their environment safely and comfortably. Think of the best equipment to use for each activity. Do they need a specialist chair, a wheelchair, bench, standing frame, a walker? They can all be used creatively, and they can all be used at different times to access different aspects of the curriculum. So don't sit the child with a physical disability on their own, even if they have to be in separate seating like a wheelchair and they can't sit on a carpet. Make sure they have a friend next to them. So children with physical disabilities may have individual targets, such as regular physio routines. Incorporate them into your planning in a fun and creative way, particularly in early years. So physical activities can be incorporated into movement sessions, which will benefit all the children in your setting. So what exercise is good for our children with physical disabilities is often good for all children. Children are very adaptable, they learn from each other, and even young children quickly give time and space to a child with disabilities. Communicate sensitively and set high expectations. So set high expectations for the whole setting. So most importantly, have fun and enjoy every moment. So how to complete healthcare plans and risk assessments. So if you involve professionals and parents and carers, meet together to go through all areas of the plan as a team, so everybody can contribute at the same time, and the child should be the focus of this meeting. Obviously, if they're very you can only involve them in some aspects of that, but it's really important that they're consulted further on in their education. So the healthcare plan and risk assessments need to be reviewed regularly, especially with young children who often progress with their skills. Medical needs can change, to make sure they're updated as soon as any needs change. The risk assessment for activities in the environment will be the same as for all children. So don't start from scratch. Build on what you have. So anything to do with clutter or the environment or steps can be added upon, so specifically for a child with physical disability. Each PD outreach team in the North and the South have moving and handling trainers, and we'll complete training with your staff and support the writing of physical management risk assessments and plans in conjunction with physios and OTs. So we will help you with all aspects of that part of the risk assessment. So how do you refer to our team? So who can refer? Most children are referred via the preschool forum, which meets monthly and covers all areas of the county. And members of the PD outreach team sit on this panel and feedback on the progress of referred children as they are discussed. But SENCOs from nurseries and preschools can refer, area SENCOs can refer, health professionals such as physio, paediatricians, OTs, speech and language therapists can refer to us. Parents and carers' consent is required prior to a referral. And you can follow the link for our referral forms there, so at Chadsgrove and at Regency, and they're on our websites. So the support parents and carers will receive. So we will offer advice on accessible nurseries and, following on from this, accessible schools, which is really important for parents when they're making difficult decisions on nurseries and schools. The best thing that they can do is work with us to choose an accessible nursery or school. We can assist with the transition, and often we do lead on the transition into school so that we can help with any meetings or paperwork that might need to be in place before support's put in place. We can liaise about the education, health and care plan process if this is relevant to the child, or any other support their child may need in relation to accessing nursery and then school. And we can offer advice on support available in conjunction with other early years colleagues in relation to all areas such as sport, swimming. So you as a setting, what support can you expect to receive from our team? So we will help you with ongoing assessment of the child's needs, including specialist assessments with regard to their physical access and maybe their recording and play. We will provide reports to contribute to the education, health and care plan process or support for school. We'll provide advice to parents and carers, in terms of what accessible schools to look at. We'll liaise with physios and OTs to ensure appropriate equipment, furniture is in place so the child can access the environment. We'll offer support with regard to the assessment process, and we'll do training into your setting on risk assessment of physical needs, safe moving and handling, IEP targets, adaptation of teaching styles and resources, advice around cognitive impacts of disability, promoting independence, safe use of equipment, the use of ICT and disability awareness. And we'll coordinate transition to school and promote effective communication between settings, including parents and carers. And we always include early years settings as part of this transition when we're starting children off into school. I would like to draw your attention to our national organisation, PDNet. So there's a link there. So anyone can join. It's free to join. Parents, carers, all staff in nurseries, schools. It provides a forum for discussion, online resources which are free to download, and it also has level 1 training on physical disability, which is free. It's interactive, online, and only takes a short time to complete. If you're ever looking at free online training opportunities for your early years staff, and that would include anyone, staff that work in the kitchen, anybody at all, I would urge you to have a look at the online training as part of the PDNet organisation. So our contact details in the north for the Chadsgrove team are on there, and Mark Loveday heads up this service, and Claire Studley is one of the teachers, and they are currently recruiting for another teacher and another specialist support assistant. And the team in the south, we've got a section on the Regency High School website, and I've put the link on there. And there's 3 senior assessment teachers, myself, Sarah Jane Corbishley, Bridget O'Kane, and our administration is run by Jane Ford, and her hours of working are there online for you to see. and the contact numbers are there too. If you would like to get in touch with the Early Years Inclusion team, their contact details are there as before, and we work with our colleagues really closely in early years. So if they can pass on information to us, if you want to go direct through them, and vice versa, we can pass on information to them. So thank you for listening. I hope you found it informative, and any questions, please don't hesitate to send them through on email. We'd be happy to answer them.